Hello, everybody, and welcome to the Nutrition Health Collective's podcast, The Practitioner's Edge. I'm Louise Ritchie, and today we have an exciting conversation ahead as we talk about the upcoming Metabolic Mastery Conference, Reprogram Your Health in Dubai on April 12th. This event is set to bring together leading experts in metabolic oncology, functional medicine, and integrative therapies to explore the future of cancer care. Joining me today on the podcast is Romina Melwani, the founder of the Nutrition Health Collective, who's organising this incredible conference. And we're also thrilled to welcome our very, very special guest, Dr. Wafaa Abdel-Hadi, who's going to be a keynote speaker and an integrative part of the day and of the conference. And we're so excited to kind of hear her insights and get a little bit of information ahead of the day of what she will be exploring on April 12th. So welcome, Wafaa and Romina.
Thank you. Yes, I'm so excited to be here and getting ready for our full day of action on the 12th of April. It's going to be a great hit, inshallah.
Excellent. Yeah, not long to go now. There's been a lot of planning and a lot of organisation, probably over the last 6 months, actually, to put this event together, and these amazing speakers and exhibitors. But let's dive into it a little bit more. Kind of starting with the big picture and what makes this conference so special. I'll ask both of you this question. You know, why is this such a kind of game changer for healthcare professionals? Wafaa, I'll come to you first.
Well, I'm very excited because over the past few years, like 10 years, I've been asked to talk about integrative oncology as one lecture in a big conference. Mm-hmm. But this is maybe the very first conference to talk about integrative oncology in depth with applied case studies to show you the importance of integrative oncology to be paired with conventional treatment to optimize the cancer care for our patients. And attending this conference, it will actually, you know, when you go to a conference and you listen to a lot of lectures and then you get out of the conference and not knowing what to do, this is what we are going to focus at. I want people who are attending this conference to finish the conference with clinical pearls that they can apply tomorrow, the second day in their clinic. It's very important.
Yeah, I'm glad you say that, because Romina and I, that's a constant that we have with when we're putting events together, that we want people to have tangible advice, practical advice, that when they walk out the door at the end of the day, that they can implement that in practice the next day.
Absolutely. I mean, the whole point of bringing in the conference is that, you know, you take this conference, it's on a Saturday, you're absorbing the knowledge, and then on Monday, you should be able to actually apply that knowledge with your patients, with your clients. And for me, that is what makes this event such a game changer.
Yeah, thank you. And actually, what I would like to touch on, as you pointed out, Wafaa, you know, you usually deliver a lecture that's one lecture on integrative oncology and a whole day of other content. But this is deep diving into integrative strategies, integrative therapies throughout the day. For those people that are kind of unclear what integrative oncology is, could you kind of explain briefly, what is the essence? What's the meaning of integrative oncology?
So let me go back in history in 2017 when I got certified with the Institute for Functional Medicine. I was first a clinical oncologist, and then I found out I'm giving all the people the same regimen, the same side effects. Some people actually, and this is not something to hide, they actually die from the side effects rather than the disease.
Yeah.
And they get intoxicated with a lot of chemotherapy, immunotherapy, radiotherapy, etc. So I had like a moment and I said, like, I've had enough of this. So, and all of a sudden I saw a lecture for Dr. Mark Hyman talking about functional medicine. I said, yeah, this is what I want to do. So when I finished the Institute for Functional Medicine certification in less than 2 years, because I was hungry for all of the knowledge, I thought about, like, so why can't we apply functional medicine in oncology, knowing the root cause of the disease? So for instance, if someone has Helicobacter pylori, which is the bug in the stomach that people have reflux, but if chronically stayed for a very long time, and if those people are genetically susceptible of getting cancer and are prone to more inflammation, they might have stomach cancer. What happens if they get stomach cancer? They go to the oncologist and they give them the chemotherapy and the radiotherapy. But no one touch base on the Helicobacter pylori treatment, because the treatment of Helicobacter pylori, it will not be eradicated by chemotherapy. It has to be addressed in the way that, like, with the conventional triple therapy or nutraceuticals and herbals that we use. So this is where my passion comes. I don't like to treat people according to the international guidelines. Yes, we use the international guidelines, but you have to dig deep into the metabolic imbalances upon which that person has developed that disease, whether it was a bacteria, a virus, high blood sugar, high insulin levels, high cortisol level, imbalance in their thyroids, a problem in their detoxification pathways, not allowing them to get rid of their toxic estrogen metabolites. Hence the breast cancer, the rise in breast cancer, like uterine cancer and ovarian cancer, is extremely high, and those are hormone-related cancers. So one of the very first thing that conventional oncologists, which I am of course one of them, do is to give them an estrogen blocker. But why is estrogen? Estrogen is like, you are a female, you should get this is part of you, the estrogen. But the problem is not with the estrogen, it's with the estrogen detoxification pathways.
Yeah.
So yes, we give the estrogen blockers, but we have to modulate the estrogen pathways so that the lady can actually benefit from the estrogen for females, and at the same time not get the toxic effects of the improper detoxification of it. This is the beauty of functional medicine.
Yeah.
And then in 2018, so I said, like, okay, I've taken the certification for functional medicine. What am I going to do about it? And then so I contacted Christy Hughes, who is going to be an integral part in our conference.
Yeah.
Christy Hughes was the director of the medical education for functional medicine for decades, the Institute for Functional Medicine. So I contacted her and I told her, listen, Christy, you don't know me, but I've just finished the certification for functional medicine and I want to meet you. And you will be in Ireland. She was in the functional medicine conference in Ireland back then. So she told me, she was so sweet. Oh my God, she didn't know me. And she said, okay, I will invite you as a speaker in the conference. What are you going to talk about? So I said, functional medicine, I'm an oncologist, but they don't want to talk about cancer. How about reprogramming your health?
Yeah.
And that was the very first time I got the idea of how to reprogram your health. It was in 2018, speaking at the functional medicine conference in Ireland. And then for some reason, one of the speakers has, it was a 5-minute slot, by the way, and I talk too much and I want to give people all the information I have. But luckily for me, one of the speakers did not show up, so they gave me his slot. It was 45 minutes. And that's when I just started my passion into teaching how to reprogram your health, take the signs and symptoms, clinical picture, now nutrigenomics, and apply this and build a personalized map, an individualized tailored plan for the patients, not one pill fits all, as they say.
No, absolutely. I mean, that's a key point. You know, one size does not fit all, and in a lot of cases that is the methodology used because that's the criteria that they're used to, you know, doctors are used to. But it's not, as you say, reprogramming your health is a good way of summarizing it, because yes, we talk about oncology, we talk about cancer, but actually the statistics of the number of people that will be diagnosed with cancer, you know, we want to ensure that actually prevention is better than cure. So, you know, if we can pre-program people's health, ensure that people are optimizing their health, you know, that they're aging healthily. You know, I know you spoke at our wonderful longevity conference, you know, in Dublin. A lot of the hallmarks of aging mirror the hallmarks of cancer. So, you know, these are completely intertwined. It's about the whole immune system becoming compromised. So how can we support our bodies and our well-being?
And I think, Louise, also piggybacking on that idea is that when you're reprogramming your health, you're actually looking at prevention. So it's not just, as, you know, Dr. Wafaa said, we're looking at a cancer diagnosis, But with this Reprogram Your Health, which we've loved so much that we've actually called our event and our conference Reprogram Your Health. It's truly about prevention as well. What can we do to prevent it? Yes, someone like Dr. Wafaa can come in and give a diagnosis to those that are currently, being diagnosed. But is there a way for remission, and is there a way for prevention? That's how I see it.
Yeah.
This is the beauty of functional medicine, because when I took the certification for the Institute of Functional Medicine, I said, I'm not gonna treat cancer anymore. I'm gonna treat chronic diseases to prevent cancer development.
Absolutely.
So, but then, of course, being a conventional oncologist, I had a lot of people coming to me for their cancer cases. So I'm just mixing and matching. But the metabolic imbalances that develop chronic non-communicable diseases are actually the beginning of developing cancer in genetically susceptible people. So we have to understand who are the people genetically susceptible, putting into mind that cancer is not a genetic disease, and then checking who are metabolically vulnerable into developing such disease, and then we act accordingly.
Absolutely. Just taking that a little step further in terms of the kind of integrative model, what are some of the some of the topics that we're going to be discussing, or you'll be discussing on the day? Some of the what people refer to as alternative. Now, alternative for me sometimes has a negative connotation, which is not the case. What are the other supportive strategies? Will you be diving a little bit deeper on the day, Wafaa?
So we'll be talking about what is metabolic health. What is the mitochondria, which is the powerhouse of our body, the genetic susceptibility, and who can get cancer, who cannot, and everybody is prone to get cancer. Now it's 1 in 2, and this is the importance of this conference, that people have to know what to do, what are the lifestyle modifications and nutrition that they can apply into their daily life to become a habit in order to prevent non-communicable diseases, including cancer. And everything will be supported by scientific evidence and researches. Because I don't want to go just and say oh, you can't eat soy. Why can't you eat soy?
Yeah.
We're going to talk about those misconceptions. Like people will say, oh, don't eat this, don't eat that, you'll get cancer. But in our conference, we're going to support the misconception. And after the Dr. Abdel-Hadi, as you know, is going to show us his amazing case studies that have been published using metabolically supported chemotherapy. And Dr. Eric will talk about the misconceptions. But most importantly, I want people to stay until the end, because I want to listen to their questions after we are...
Thank you, Wafaa. I mean, that sounds like there's a vast array of information and wonderful knowledge that is going to be shared on the day. Romina, I'd like to ask you, who is this conference relevant to? Who should be turning up on the day, as it were?
So for me, it's not just oncologists turning up to the event. I truly believe when we're looking at functional medicine, prevention, remission, we are looking to invite nutritionists, functional medicine doctors, traditionally trained doctors, naturopaths and holistic practitioners to come and learn, because someone like Dr. Wafaa, who has both sides, she's got this experience with oncology, traditional oncology, conventional treatments, but you also have the beauty of having an in-depth experience in functional medicine. So for me, this is relevant to every single healthcare professional that wants to polish up their skills and take their knowledge to a whole other level.
Wafaa, one thing that I'd like to ask you, because sometimes you find the biggest challenge we have in this field is skepticism around, integrative therapies or alternative therapies, as they're often known. What is your view on that?
Well, of course, because when someone gets the cancer diagnosis, they just rush into an oncologist. And to tell you the truth, even back then when I was an oncologist starting in 2002, I didn't know anything about supplements, and I was afraid to use curcumin or vitamin C, even because it has an antioxidant property, and that will mess with the efficacy of chemotherapy. But now we have major studies about using intravenous vitamin C, and that's what Dr. Hadi is going to talk about, and its scientific background, using curcumin and how its conjunction with chemotherapy actually protects the normal cells and increases the efficacy of chemotherapy. Our message here is, as Romina said, not only for oncologists, but I wish a lot of oncologists could attend this conference, because it will really improve the cancer care overall, the quality of life, the recurrence rates, everything. If we integrated all methodologies together. The beauty about when a cancer gets when a patient gets the cancer diagnosis and the scare, they go to an oncologist and they give themselves or surrender to the oncologist. Some of the basic things, to tell you the truth, for instance, according to scientific studies, there has been the prognosis of colorectal cancer is inversely proportionate with the level of vitamin D.
Wow.
And these are scientifically proven studies. So if vitamin D level is above 60, the prognosis of colorectal cancer is better and the risk of recurrence is lower. So those are the things, like if someone gets colon cancer, check your vitamin D levels. Don't rush into surgery before you correct it. Stuff like that can be actually in the basics of every oncology practice. The importance of vitamin D, the importance of homocysteine, the importance of exercise, those are things that are not like myths anymore. And it will actually improve the conventional oncology treatment. If someone, I need hence my clinic name, Aware Clinic, I need all people to be aware about the knowledge that they have to acquire if someone got cancer diagnosis, if someone got rheumatoid arthritis. Don't run and take your steroids before you optimize your recovery fundamentals first. Stuff like that should be optimizing your metabolic health prior to starting a conventional treatment, or according to the severity, you do them together.
Yeah, it's optimizing the terrain, that you have, so that the treatment strategies work more effectively, and your body is in a healthier set to avoid the side effects as well of those treatment strategies.
Absolutely. And all are backed by scientific evidence. It's just that when I was an oncologist, I used to see 30 patients per day. 30. Now I see 6 patients per week. Because it's a lot of work. So when I'm an oncologist seeing 30 patients per day, and then you ask me to read an article about vitamin C, of course I will not bother looking at it.
Yeah. But that's also, as Romina said, this is not just relevant to oncologists. It's relevant to oncologists. It's relevant to functional medicine doctors. It's relevant to nutritional therapists. It's relevant to a broad spectrum of healthcare professionals who we can all work together. This is not about, this is your remit, this is my remit, and never the twain shall meet, is the expression. It's about us all working collaboratively, and I think that's the true essence for me as well, Romina, of the day and the agenda for the day. We have a great mix of amazing speakers.
We do, and the fact is that even the speakers among themselves have, very specialist knowledge in their fields. I met with Dr. Heidi Kusman last week, who's one of our speakers, and she works at the Bourgil Cancer Institute. And what she told me was what she's seeing in practice right now is more and more women that may have breast cancer or other, cancer diagnosis, but they're coming at a younger age, and they seem to be more chemo resistant. So, she's come up with these amazing infusions and treatments. And I know that, Dr. Wafaa or Dr. Abdel-Hadi, being oncologists, are actually working with Dr. Heidi, or they can actually learn from each other. So yes, it's for the practitioner to get all the information on the day, but it's also, as you said, Louise, to learn from each other. Because if we're talking about, alpha lipoic acid or IV therapy or hyperbaric chambers, but we're also talking about black cohosh with Dr. Eric, who's going to demystify some of the myths, as Dr. Wafaa said. So it's truly a large array of different specialties within functional medicine, and also within metabolic health.
Yeah, and actually a good way of explaining it is we're putting all the pieces of the puzzle together. We're bringing all the pieces of the puzzle together, and they can work collaboratively and share all their wonderful knowledge for those that are attending. So it's really, really exciting stuff.
There are two panels as well that I wanted people to know about is, yes, we're bringing these experts together, but we're also bringing in some very powerful panels, as we call them, where we're going to have discussions and debates on these treatments. We're going to see if they work. We're going to be talking about nutraceuticals and their place in this puzzle, as well as, the role of testing. So I'd love to have those conversations and dive deep into understanding all of these elements.
No, don't forget the recorded webinars. So we have Emma Bizik, Life Code GX, talking about cancer genetics. We have Romina from the Walter Longo Foundation, and we have Mara Bain, we have Dr. Matt, Sam Watts. So amazing. And please, you have to listen to those recorded videos prior to attending, because it will complement everything in the sessions. I wish we have like a 5 days conference, but since we don't have the time for that, so it is actually complementing each other, whether it was the on-site sessions, the recorded sessions, and the panel discussions, of course.
Yeah, and I'm glad you brought that up, Wafaa, because actually also what we do for all of our conferences is that all the recordings that are available, the live recordings, the on-demand recordings, are all available 3 months post-event. So, if you don't get a chance to view everything or hear everything on the day or live stream everything on the day, you'll have 3 months to access all this amazing content and presentations, or go back and review. If you hear something on the day and you want to dive a little bit deeper and hear it again, you can do that for up to 3 months post-event. We've also got exhibitors. Let's not forget the exhibitors that we've got on the day. Romina, could you share some of those with us?
This is why I felt testing was so important, because we have, testing companies such as LifeCode GX, as Wafaa said, but also KBMO Diagnostics that specialize in gut testing. When it comes to nutraceuticals, we have beautiful companies such as Apex Energetics. We have Immune AE that are locally sourced in Dubai. We have Amrita Global. We have Body Bio with their amazing butyrate. So for me, we're really bringing in that conversation on, what is it that you're going to use in practice once you've understood the knowledge, but also coming to the event, visiting the exhibitors and, receiving offers, testing their samples and understanding a little bit more how it's actually relevant to your practice.
So actually, big question, Romina, how do we sign up? How do we register for this wonderful event?
Very, very easy. All you have to do is head to the Nutrition Collective website or to the conference website, metabolicmastery.nutritioncollective.co.uk. And you can register. At the moment, we have a 15% discount using the code NC15. So whether you'd like to come in person in Dubai at the Move Jumeirah Beach Hotel, or in person, we would be delighted to invite you and to have you there with us.
Excellent. Excellent. And before we wrap up, Dr. Wafaa, Romina, are there any final thoughts you'd like to give anybody who's listening about the day? Any final words of wisdom or reasons to encourage them to attend if they haven't already?
I'm just super excited about this day, actually, and being stressed out. I'm taking my adaptogenic herbs just to calm my stress, because it's going to be fantastic. And and as we are working on finalizing the last minutes of the agenda to make it just relevant to each other's, because I really need people to attend, whether, as Romina said, oncologists, doctors, nurses, health practitioners, because if we all have this knowledge, we will be able to help millions and billions all around the world. So it's very important to attend, whether on-site or in person or online. It will be amazing. And most importantly, I'm waiting for the questions, because those questions are the one that actually opens the horizons. You think you know it all, but we never know it all. But when people ask me a question, it then clicks, and then, oh, I don't know about this, and then the studying continues, which is forever. So, and as you said, Romina and Louise, we learn from each other. So Dr. Abdel-Qadir Slocum has a side that I don't use, because I don't use hyperthermia and hyperbaric oxygen therapy in Egypt. I actually refer to him or to my other colleagues, and Hidi has had hands-on experience with intravenous nutraceuticals for many years, which actually I haven't used in my practice. However, I actually refer to them, or I guide nurses online on how to do it to their patients. So it's a collaborative, presence there that we will all benefit from.
Yeah, absolutely.
I think that, truly I would invite everyone to join this, because the landscape of when it comes to integrative oncology or chronic disease is constantly changing. And what we're doing at the conference is we're bringing you up-to-date knowledge. We're bringing the latest clinical insights from worldwide known experts that actually have that knowledge to share. And it's, as you said, Wafaa, evidence-backed. We're not just inventing things here. We're bringing in the knowledge, but we're bringing in the evidence. And this is where I feel like we stand out, and we would give you something that truly would make a very big difference in your clinical practice.
Yeah, absolutely. And I think the one thing that I would love to touch on, from my experience, attending these amazing conferences, being part of the Nutrition Health Collective, is the community, being there in person, the community spirit that is brought together by the events that Nutrition Health Collective put together is just amazing and very powerful. And experiencing that firsthand is wonderful. And as you've said, both of you, Romina and Wafaa, integrative therapies are so powerful, and we do need to work together, and we need to have a presence in the world to make a change, and make a big change, a powerful change.
And I do believe one last thing to add is there will be an integrative lecture between me and Christy Hughes, and it's just that if people follow those lifestyle modifications and the steps that we are going to offer, they're not just gonna prevent cancer, but they will actually stop and reverse non-communicable diseases, obesity, how to manage weight management without having to cut half of your stomach or insert a balloon or do all of these things, which might be important for some people. Some people, like, the only way for them to lose weight when they have morbid obesity is actually to put a balloon or do a bypass, etc. However, you have to do those things first, do the effort. Have a health coach beside you or a health practitioner to guide you through them. And then afterwards, it's all about metabolic balance and metabolic flexibility.
Absolutely. Well, thank you both. Thank you for your time today. I really appreciate that. We've had a wonderful discussion. And just a reminder, if you want to find out any more about the event, go on to the metabolicmastery.nutritioncollective.co.uk website, or go to the Nutrition Collective website and find out more. Look forward to seeing you all in Dubai. Thank you.
Thank you for having me.
Thank you.